We did our presentation on Tourette syndrome. What is Tourette syndrome? Tourette syndrome is a condition that causes a person to make involuntary sounds and movements called tics. People with Tourette's syndrome tend to have other types of disorders, such as obsessive compulsive disorder, which is OCD, and attention deficit hyperactivity disorder, which is referred to as ADHD. And then I saw a quote from the Tourette Association of America that said, "We do believe that Tourette syndrome is commonly misunderstood to be a behavioral or emotional condition rather than a neurological condition. Therefore, including Tourette syndrome in the definition of other health impairment may help correct the misperception of Tourette syndrome as a behavioral or conduct disorder and prevent the misdiagnosis of their needs." Tics usually appear between the ages of 2 and 14, with the age of 16 being the average. And then here's a video that kind of goes over everything.
Tourette syndrome is characterized by recurrent involuntary movements or sounds called tics. Tics can be classified as simple or complex. Simple tics usually involve only one group of muscles and might consist of actions like eye blinking or throat clearing. Complex tics are more elaborate and might involve actions like reaching out to touch something or the involuntary use of obscene language, which is known as coprolalia. It's worth noting that coprolalia, while often associated with Tourette syndrome, is actually thought to occur in less than 20% of cases. The neuroscience of Tourette syndrome is still poorly understood, but a number of studies suggest an important role for a group of structures known as the basal ganglia, which includes the caudate, putamen, globus pallidus, substantia nigra, and subthalamic nucleus. The basal ganglia are involved in diverse brain functions, but they are especially relevant to Tourette syndrome for their hypothesized role in suppressing unwanted actions. According to this perspective, one function of basal ganglia circuitry is to inhibit neurons in the thalamus and prevent them from sending undesired movement-related signals to the motor cortex. In Tourette syndrome, it's thought that faulty inhibitory mechanisms in the basal ganglia may fail to stop unwanted signals from reaching the cortex. This causes the execution of an action that the patient might prefer to suppress, forming the basis for tics. The failed inhibition in the basal ganglia is thought to be coupled with increased activity in motor pathways that generate movements. Thus, patients with Tourette's might experience a problematic combination of high motor activity that generates habitual patterns of behavior, along with abnormally low inhibitory activity that would normally keep those behaviors from being acted out. More research needs to be done, however, to fully elucidate the neural circuitry underlying the disorder.
All right, some behavioral manifestations of Tourette's. Disinhibition, which is the inability to suppress an inappropriate or unwanted behavior, such as the shouting out of bad words that the guy was referring to in the video, jerking, jumping, touching other people or objects, oppositional behavior, which means not listening to people who are in authority, immature behavior, which means not acting of the person's age, not acting how old they are. Like I said before, OCD, obsessive compulsive disorder, anger, difficulty with transitions, and again, use of inappropriate language, but it only affects about 1 in every 10 people with Tourette's.
So how does it develop? Tourette's syndrome has been linked to numerous parts of the brain, like it was said on the video, the basal ganglia, which aids in the regulation of bodily movements. Differences in these locations can influence nerve cells and the substances that convey impulses between them. The vast majority of Tourette's cases are caused by a mix of gene alterations and environmental factors. Although the cause of it is unknown, past research suggests that it can be caused by defects in certain brain areas. The routes that connect those regions and the transmitters required for nerve cell are required for nerve cell interaction. People who have Tourette syndrome in their family are more likely to develop it themselves. However, members of the same family can exhibit different symptoms. So yeah.
The neural and genetic basis of the disorder. The genetic basis of common disease is defined as the hereditary material acquired at conception. This determines the likelihood of someone having the disease. Tourette's is caused by a likely complex genetic basis interacting with environmental factors. The genes listed, so the SLITRK1 gene and the MAOA gene, they have been repeatedly shown to have an implication with Tourette's. At the beginning of tic action, significant fMRI activities were found in the sensorimotor areas, including the superior parietal lobe, bilaterally in the cerebellum. The results of this study indicate that paralimbic and sensory association areas are critically implicated in tic generation, similar to movements triggered internally by unpleasant sensations, as has been shown for pain or itching.
So there is no cure for Tourette syndrome, but there are possible treatments that can help individuals manage the tics that they have. So some possible treatments are, there's medications that can reduce the tics and reduce the symptoms that are related, such as ADHD or OCD. There's behavioral therapy that the individuals with Tourette's can go through. There's also habit reversal, which is a awareness training and a competing response training. And then there's a newer technique called comprehensive behavioral intervention for tics, CBIT. It's an evidence-based type of behavioral therapy. So it uses relaxation and the habit reversal techniques to lessen the severity of the tics. So for example, the individual will go through some type of training that will make them aware of the tics and then be able to notice them before they happen, and then use a type of competing response, which is like an action to lessen the tic. So for example, they could be aware of the tic that's coming and they could put their hands on their knees or take their mind away from the tic, and that can help with lessening the tic. So there's many people that have Tourette syndromes that the tics don't get in the way of their daily life, and therefore they don't technically need any treatment. However, there are some individuals that have tics that cause pain or interfere with their daily life, such as school or work, and they are able to have these medications or behavioral treatments. But one of the biggest supporters of these treatment, one of the biggest support systems of these treatments is being able to have the people around you educated on Tourette syndrome and having them support you. And there's lots of parent trainings for individuals that have Tourette syndrome. When they're younger, there's parent trainings and other resources through schools that can make it easier for individuals with Tourette's to have a more successful life.
And this is just all we're excited. That's it. So I think I can just when I upload it onto, or when I turn it, whatever, stop recording, I can upload it onto, I can share it with you guys, or I can upload it onto YouTube, and he said we can trim it that way so we don't have to have the beginning of us talking and that, or whatever
Yeah.
part. So I can trim it if you guys want and send it to you, or whatever you guys want to do.
Whichever is easier for you.
Okay,
Yeah.
I will stop recording.